The future I want is a future that meaningfully engages young people of all diversities.
I look forward to a future free from discrimination and marginalization.
The future I want is a future where there is freedom for everyone, rights for everyone, and where young people can fully achieve their potential.
We have to do everything we can to remove those barriers and to physically put in those structures that will allow everyone to be able to access the opportunities with which we can solve to these problems in readiness for tomorrow. And we can't do that if we don't collaborate.
We and the broader Global Fund community are acting with urgency to help countries respond to COVID-19, but also to take action to mitigate the knock-on impact on other diseases such as HIV, TB, and malaria. We need to see the same kind of mobilization, the same changing of the rules around the way science interacts with politics, interacts with communities, the way people across the globe coordinate and work together if we are going to get an effective response to this crisis. And that needs people like you.
The future is also young, in fact, very young. I want a future that embraces and acknowledges young people.
The future we want at IntraHealth is one where young people see themselves as leaders in the fight for global health.
So it's up to us as humans to come together, to join our hands, your small and my small coming together and creating this big thing that will eventually shift the way the world is known to be.
Hi, everybody. Welcome to Switchpoint Exchange. We're so glad to have all of you here. My name is Heather Lagarde, and I'm the producer of Switchpoint, along with Sarah Abernathy, my colleague from IntraHealth, and a bunch of our team from IntraHealth also on board. We really wanted to thank the Global Fund and Gavi for being a part of making this possible and sponsoring this event and gathering for everyone. Many of you who are here have been in previous Switchpoints, including that last trailer that we had, which was the Youth Voices Global event with the Global Fund earlier this year. We just are thrilled that you are here today. There are incredible people here, and we'd like to invite each of you to get into the chat, tell us who you are, tell the others who you are, what country you're coming from, and what you do. We'd really like to see that in the chat so we can all get to know each other. We'll be recording this meeting, and segments of it will be included in the next Switchpoint public event, which is in October, and we hope all of you will be there with us for that event. But we do want to let you know this will be being recorded, and we would like to be using your thoughts, your ideas to incorporate into that and to include segments of it in the October event. So if you have any questions about that, also put that in the chat. We're going to be taking a time machine together into the future for today. We're going to be seeing some of the top leaders in global health with us on this ride, as well as actors and dancers, puppeteers and poets and policymakers. And we see you as leaders in global health, in the fight for social work, social justice around the globe, and we can't wait to hear more about your ideas. We wish that we could be meeting in person. Normally Switchpoint is here or in physical locations around the globe. Obviously, we haven't been able to do that for a while. So we're gonna try to make this as creative and interactive as we can while we're separated by screens. But let's try to connect with each other. Switchpoint is about networking and about connections. We're thrilled to partner with the Global Fund, with Gavi, with ThinkWell, and with IntraHealth together to have this conversation. And we wanted to tell you just one thing, just so that we go forward. If we're having any technical difficulties, or if you're having trouble hearing, also put that in the chat so that we can follow up with you and make sure that everybody is present together. Last note would be that IntraHealth produces Switchpoint because we believe in creative partnerships, solutions for health workers, and global health, and the thriving lives of people around the world. So joining together in this crazy time is something very special to us, even if we're far apart. We're going to show you a little quick clip of what Switchpoint is like when we are in person together. I'm in the place where we normally do Switchpoint, and I'm here all by myself, wishing that you guys were with me. So here's a quick clip to give you a sense of the creative nature of SwitchPoint so that we can all start this in an informal way, get to know each other and go forth. So Jeff, if you could share the next clip, that would be great. So that's just a little sense of SwitchPoint. Let's stay creative and connected together today and get to know each other. This is informal and it's intentional. We admire each of you. You have been invited intentionally into this conversation. We cannot wait to hear your ideas, your solutions, your troubles, and work together. So thank you for being part of this. And up first, I'd like to introduce Yared Nagesh from the Global Fund, who's going to give us our next talk. And thanks so much, everyone, for being here.
Okay, so hi everyone, I'm Yared Nagesh. I'm currently at the Global Fund in the Health Finance Department. So I'll briefly tell you about myself and how I've gotten engaged with the issue of domestic financing of health in Africa. So I grew up in Zimbabwe against the backdrop of a number of health crises. And while I was fortunate enough to be afforded quality healthcare, the same could sadly not be said of most Zimbabweans. And this spurred me to get involved in improving healthcare in Africa and eventually led to me studying health economics, during which it became clear that a significant part of the solution to increasing health in Africa is increasing government expenditure on health. So in many ways, the Global Fund has demonstrated the effectiveness of informed investments in health. So for those of you who don't know what the Global Fund is, it's a multilateral organization which provides financing for healthcare globally. So the Global Fund predominantly invests in AIDS, TB, and malaria programs, but also invests more broadly in strengthening health systems and is supporting the national COVID response. So ultimately, though, the Global Fund's goal is to support the development of resilient and sustainable national health systems. And as the Global Fund nears its 20th anniversary, I think it would be fitting to acknowledge the extraordinary progress that could be made through efficient spending in health. So in countries where the Global Fund invests, annual deaths caused by AIDS, TB, and malaria have halved since their peaks. And over this period, the Global Fund has saved an estimated 38 million lives. So while we were gathered to discuss domestic finance, the transition to domestic finance while urgent, will also be gradual and require the support of donors. So therefore, the continued support for the replenishment of the Global Fund for its next funding cycle in 2022 continues to be pivotal in building resilient health systems in Africa. But despite the development assistance Africa receives for health, there are inevitable funding gaps, and the onus is largely on national health budgets to fill these and not individuals through out-of-pocket payments. The current health financing situation in Africa leaves a lot to be desired, unfortunately. The African continent lags behind others in terms of government expenditure on health, both as a percentage of total government expenditure and in per capita terms. So we as young Africans need to insist on greater domestic investment in health not least because of the fact that close to 60% of Africans are under 25 today, and today's youth deserve the right to health and financial protection from healthcare costs. So I believe that the investments in health align with our moral intuitions about health as a human right and our economic interests. As such, we need to urge our governments to prioritize health in order to not waste the enormous potential of this young generation. And also to bear in mind that the poorest and sickest often suffer most from the current arrangement due to high levels of out-of-pocket expenditure, which pushes households who choose to pay further into poverty and households who choose to forego care further into health, deepening inequities. Another reason we need to advocate for greater domestic spending on health is that donor funds will eventually dry out. The continued reliance on external funds is a precarious position for a national health system to be in. Several countries in Africa are already transitioning out of eligibility for significant funding streams, including Global Fund grants. In sub-Saharan Africa, development assistance for health on average constitutes around 20% of total health expenditure, while government expenditure on health constitutes about 35%. It is also important to consider that the COVID pandemic may lead to a tightening of global purses as the economic cost of the pandemic becomes more evident. Additionally, the rise of far more costly non-communicable diseases such as heart disease, diabetes, and obesity are on the rise across the continent and will burden already fragile health systems. For these reasons, there's a real need for governments to mobilize existing resources and generate additional revenues to finance healthcare. There are, however, reasons to be optimistic. The WHO estimates that in low and middle income countries, 85% of the costs of meeting SDGs health targets can be met through domestic health financing. The African Union has recommitted itself to investments in health, most recently through the African Leadership Meeting Forum. And additionally, the health profile in Africa means that there are many low-hanging fruits. Several of the leading causes of mortality have cost-effective and scalable interventions. And while we urge our governments to invest more in health, we should also urge governments to invest more efficiently and more equitably to enable young Africans across the continent to live out healthy and productive lives. Thank you, and I look forward to hearing some of your solutions and ideas about health financing in Africa.
Welcome to this interactive session, Future of Health Work in Africa, Who Pays for It and How? A timely workshop by Switchpoint Virtual Exchange with IntraHealth, the Global Fund, and Gavi, the Vaccine Alliance. A very warm welcome to everyone here. Nkondena Metachu, as we'd say in the Ethiopian national language, Amharic. My name is Dr. Lydia Husfeit Adese. I am a medical doctor, a public health advocate, and a One East Africa champion from Ethiopia. In partnerships such as that of Gavi and One Africa, we are able to come together and engage in such important conversations about the future of health work. One Africa brings together young, vibrant, and aspiring volunteers from all over the continent through one campaign, a global movement campaigning to end extreme poverty and preventable disease by 2030 so that everyone, everywhere can lead a life of dignity and opportunity. Gavi works to save lives and protect people's health by increasing equitable, sustainable use of vaccines. Since inception, Gavi has reached 364 million unique children and adolescents in Africa with routine immunization programs. Nearly 173 million children were immunized with pneumococcal vaccine against the leading cause of pneumonia. Overall, Gavi immunization programs have helped prevent more than 8.9 million deaths of children. Preventing deaths through life-saving vaccination is a great starting point for this conversation that we're having today. Why do I champion immunization in child health? Because immunization services provide a path to reaching missed communities with essential primary healthcare services. Immunization is the only intervention through which a majority of households come into contact with health system about 5 or more times in the first year of a child's life. When, as young people, we ask for a healthy 2040 generation, we're asking for investments in health system, from supplies to infrastructure and to health workforce that ensures strong primary healthcare system able to reach people everywhere. Africa and the world now face the worst pandemic that's threatening economies, creating further inequities as a result of movement restrictions, lockdowns, and curfews. This means that the population that have traditionally been far from health systems have now been pushed even further away. They now don't just lack healthcare and routine immunizations, but they're also faced with the challenge of accessing COVID-19 vaccines. Improving access to immunization at primary healthcare means that we can expand aspects of healthcare service provision and ensure no child or adolescent misses out. What do we know about health workforce, one would ask? We know that our government committed through the Abuja Declaration to allocating 15% of government budgets to health in order to address pressing continental health challenges, including ensuring a sustained and scaled-up investment in routine immunization. We know that health workers are central to a strong primary healthcare system, which serve as a first point of contact for youth and communities as they seek service provision. We also know that it's through health workforce that communities, especially women as caregivers and mothers, learn to trust and continuously demand for health service immunizations for their children. A strengthened health workforce means that we can collect important data on immunization from communities all the way to the national level. This data is important in an ever-changing and growing population landscape in helping us understand challenges of accessing immunization and other health services, where populations are and why they are yet to be reached by life-saving immunization for their children. What we must remember and do together. When I think of a strong primary healthcare system, I remember my experience working in one of the districts in Ethiopia, when a local farmer could only afford to pay for one of his 2 sick children that required out-of-pocket fees at the hospital. This was heartbreaking and may still be the reality in many communities across the continent. As youth advocates and believers in individuals' and communities' rights to quality healthcare, including life-saving vaccines, financial constraints should not hinder access to healthcare service provision. We must collectively and individually, within our groups, in our countries, and across the continent, start speaking and connecting and asking the questions that matter. Who will pay for health workforce 10 years from now? How are governments preparing for a continent that's healthy 10 years from now? This is because Africa has some of the highest birth rates and the largest concentrations of young people in the world. The full development of Africa's human capital as the most precious resource is enshrined in the Africa Union's Agenda 2063 and echoed in 2030 Agenda for Sustainable Development. Investment in health is a prerequisite for the attainment of these aspirations and goals, yet they can't be achieved overnight. Young people and children must be the drivers of these goals, because we need to get to 2040 with a strengthened health workforce in a strong primary healthcare system. Once again, we're glad to be part of a wonderful discussion platform. Have fun, make friends, network, and keep the conversation going. Thank you. I'm a second.
Good morning, my name is Arati Krishnan. Global efforts for social good have traditionally pushed a very rigid view of what progress looks like, steeped in pillars of a northern-dominated world order. We can argue that the systems and frameworks that have served us to date may have improved development outcomes for many, but it hasn't done so equally, and it has been at significant cost. The world we inhabit today is increasingly sleepwalking into climate catastrophe. It is more unequal, more disconnected, and more divided than ever before. The future, as we know now, is complex and uncertain. It's no longer siloed issues of great drivers of change and transformation that we're talking about, but rather compounding, intersecting risks and issues. The challenge then that we face as humanity is how will we steward our planet well, not just for ourselves today, but for current, next, and future generations. We must, all of us, ask of ourselves one fundamental question. What kind of ancestors do we want to be? because it is the answer to that question that will determine the actions we choose to take today. The practice of strategic foresight challenges us to see that past hegemonies don't necessitate a similar future state, and it seeks to ensure that in our journey to jointly flourish, we don't leave anybody behind. Ultimately, it pushes us to interrogate the changes in practice, practices, culture, and investments that ourselves and institutions need to adapt in order to be fit for whatever futures might emerge. However, this very practice can be steeped in bias and surface-level rhetoric, not deeply interrogating what is needed for us all to change and adapt in complexity. Any kind of transformation for social change, for social good in the 21st century today will only be truly effective if it is a systemic interrogation of all drivers of change, not just the big loud ones. If it tackles and pulls out bias, it is representative of all peoples and all futures and clearly linked to strategic reform. When futures frameworks, ideas of the future, only put forward visions or markers that just push one dominant and singular narrative, it limits our questioning whether measures of global poverty to date have considered colonial history, the implications of inequality from brutal economic policies, or planetary implications from industrialization. It reinforces future progress as singular, linear spectrums that build on the trajectories of our history. And it assumes that those ideas of progress are the only ones everyone wants to aspire to in the future. It reinforces power imbalances and excludes those that don't have the same kind of access to participate. It can result in crippling inaction if reimagination is not systematically linked to levers for societal, political, and institutional transformations. So how do we push for a complete reimagining of our collective futures so it doesn't merely replicate the inequalities of the past? We design through our own eyes, and so whose futures are we building, and what kind of systems can we design that can help ensure just, equitable, and safe futures for all? As Arundhati Roy said last year, we can choose to walk through this portal that we're facing right now, dragging the carcasses of our prejudice and hatred, our avarice, our data banks and dead ideas, our dead rivers and smoke skies behind us. Or we can walk through lightly with little luggage, ready to imagine another world and ready to fight for it. Thank you for having me. Best of luck with everything that you do. Now more than ever, we need to ensure that we are designing the types of futures that future generations will be safe and have the ability to flourish in. And I so look forward to see the efforts that you will partake in now and into your lifetime.
Good morning, good afternoon, everybody. My name is Dai. I am the managing director from ThinkWell Global. And I'm so happy to be here for the workshop, and I'm working with you. Before getting really into the fun part of this workshop about the discussions and then meeting new friends, and then also getting on to the time machine that we created for you, I just want to talk a little bit about this work that we have done for the Future of Health Work in Africa 2040. Next slide, please. So why should we be talking about the future? And we already heard of the great keynote speakers, and then also that the other young leaders, that it's very important for us to think about future, because whatever that we do now, we will shape that the future of the healthcare that the people can access to. And then you as a young leaders, what you would advocate for and then support, or maybe even sometimes that what you are going to protest against will shape the future. So we want to think about how the future could look like. And then also then how we can take action so to prepare our future. So in 2019 to 2020, In collaboration with IntraHealth, we conducted the work of the scenario planning for the future, and then I will just quickly talk about that. I'm including the link to the report in the chat room if you are interested. Then next slide, please. So what we did was we talked to a lot of people about the thinking about what would disrupt the healthcare for the future and then how the future is going to unfold. We talked to politicians in Africa, we talked to technologists, we also looked at the environmental issues and then talked to the environmentalists. And then obviously that we needed to talk with demographers and then public health specialists and economists. And then we also gathered that the various data points which are shaping our future of the healthcare. So after this, the work that we have done, this happened. Next slide, please. The pandemic happened. And Jeff, can you click one more? Who knew that we're going to face with this major pandemic in the world? In our study for the future scenarios for the 2040, many people did talk about the possibility of the pandemic happening, but then nobody said that the pandemic is going to happen next year or following in 2020. And then nobody really said that we will be able to come up with vaccines. We're going to struggle with finding the protective equipment, and then major economic disruptions that we experience. So it's really important for us is not so much about predicting a singular future, but then more like thinking about the potential of the different outcomes that we are going to face and then prepare ourselves. Next slide, please. So usually when we do a forecast planning or future predictions, we tended to say like what we know today and then within minus 10% or plus 10% ranges that maybe this is what's going to happen. And then just exploring from the recent past and then for the future. But then, again and again, our ability to predict the future is shown to be very limited. So click one time, please. What we did instead was by talking to all those different people, understanding that what could disrupt our future in the healthcare and what kind of uncertainty exists, and then try to envision the multiple future scenarios. Like what kind of stories that we're going to be living in 20 years from now. And then collectively thinking about what we could do today so that the future will be much better and then the future will be what we want. So that's the type of the study that we did. The next slide, please. So basically what we found was that our future of the healthcare will likely to be influenced by two axes. One is this benefits of the technologies. It's no question that the technology is already started to influence how the healthcares are being provided and people access to the healthcare. But the benefits of, can we really harness all those benefits of technologies? Collectively, everybody will access to the health technology, or just that the rich people will access to it, and then the benefits will be very patchy and then sporadic. Another axis that we need to look at is the power structure in how the healthcare is being decided and managed and controlled. Is it really current structure will continue, or power dynamics will be there? Or will it be much more transformed because of this digital innovations and then democratizations and then other political movement that the new leadership emerges and then reshape the world? So depended on how those two power accesses are going to influence the future, we envision the 3 different scenarios, and then you're going to see that those future today. One scenario is called the Father Together. This is where the healthcare is united for Africa, and then this is no longer some international organizations or the singular government organizations' power in deciding what you can access or what you cannot access. But then the health is much more considered for the well-beings, and then the broader people will have access for the future. And then the governments and then people's ability to harness the health technologies benefits will be much stronger. On the other hand, another future that we envisioned was cyberpunk chaos. This is where a lot of technology will come in, different qualities. We lose the handle on those technologies control, and then the people will be not have a good grasp of what they are doing with the health data, and then food providing the healthcare, different quality emerges, and then that's just going to be a technology-driven chaos of the healthcare. Finally, that if we remain at the current day, if we keep the current day power structure, and then we're not really doing a great job in the harnessing the technology's benefits, then we're going to be in the orange box, which is the muddling through. That it's going to be a status quo, that the doctor will have the power, or like an international donor will still keep the power there. And then the progress will be made here and there, but there will be a very patchy progress. So those are the 3 futures that we have started to experience. Next slide, please. So today, and then future, that there are 3 scenarios: cyberpunk Africa, Father Together, and then muddling through. So instead of continue with our boring PowerPoint slides, what we did was that we enacted some of these futures into the scenario-based movies. And then we have used a script writers and actors to come up with the future scenarios where you can peek into it. And I'm going to be happy to share those movies with you and then start to have the discussions. And then I want you to meet with those future citizens, and then let us know what they will tell us what they think, and then they're going to tell you what they're experiencing. And then after that, each scenarios, we're going to have the short break, and then we'll have the discussion of how the future is going to look like. The first scenarios and the first movie or time machine that I want to take you to is the Cyberpunk Africa. Cyberpunk Africa is like health cares are done by the health data harvesters. They will take your health data and then manipulate, and then also uses it for their profits. And then there will be a lot of gig workers like Ubers and then type of the healthcare workers. They will provide a part-time supports. And then the patients themselves or families themselves will use the technologies to diagnose and then do whatever the medicines they have access to. There will be a lot of AI-assisted computer technology tools be there, but then their qualities are not very well controlled. And then there are a lot of degree of that confidentiality issues and security issues. There will be somebody who probably the managing those concierge services for those high-income patients, which one you should use, which technology will be better for you, type of the discussion will be happening a lot. And then there will be a lot of health labor market will be very fluid, and then who claim to be a health worker will be very different from the current day. So why don't we look at and then meet the Cyberpunk Africa's citizens now? Please go to the movie.
Hello, and peace out there to all my lovelies. I'm Bree, and welcome to our channel which covers all things technology and society, all the E's.
And I'm Zoe, giving it to you straight. Today we are going to deliver the goods to you related to the highly anticipated release of 8-Bit Nano 19.0, including the history of the 8-Bit Nano 1.0 series and how we got here. It is so exciting! Before we get started, please do us a kind and like and subscribe to this channel and tell your friends about our awesome page. Blink twice to ensure that your DigiContact lens links to It's All About MeTube for updates through the night and into your dreams. Be the first to know even before you wake up. And if you don't know what I'm talking about, then you are 80 years old and you can still find us on your flip phone. What's that? As anyone with 27G connection knows, 2 years ago, the OG pioneers in wearable tech, 8-Bit Global, stunned the world with their introduction of 8-Bit Nano. This release shocked and disrupted the wearable market by actually injecting nano sensors into the body where they measure all sorts of things previously thought out of reach from current wearable tech. Awesome!
And a little creepy too, right?
Pay extra and turn the incriminating data off.
Okay, so the price tag for the 1.0 was a bit, shall we say, insane. 12,000 AUC plus another 250 AUC monthly fee for access to your 8-Bit Life page, where you can see graphs and figures, future predictions, life expectancy based on your actions, updated by the hour, drone on call, therapy bot, blockchain vaccine lottery, and all the bells and whistles.
Absolute bonkers of a price tag, right? Well, it turns out that it was priced right because nanos were flying off the shelves. And it's all because of the capability of those lovely little sensors inside the unit. Sure, they measure heart rate, body temperature, but these nanoparticles can also measure blood, oxygen, and viral content in real time, as well as your internal plastics ingestion rating. And this means that it knows what you are eating, how well you can metabolize or digest what you are eating, or being exposed to, and can make customizable dietary, toxic self-cleanse, medication and exercise records for you. And it's all personalized specifically to you and your environment. It knows if you are stressed. It knows if you have been exposed to the latest variant, or in the vicinity of any communicable disease with PPE and distance alarm built in. It rates your happiness. It can read that cough or sniffle and map its chemistry. Want to lose weight? It locks your digital food budget. Hooray! Depression, anxiety, you name it, it knows it. Do you need to be medicated? Of course you do. And here is the prescription because your doctor has been notified already. The drone full of medication is on the way. Say hi. Come on, yo. The only thing this thing can do is fly you to the pharmacy.
Yet.
So yeah, this thing is awesome. But we all know the controversy surrounding this product and the company. First, inaccessibility. Only the richest can buy it. The people that need it the most, nope, you can't afford it. Lame. Second, data accuracy, data rights. Remember that global jury court case last year? A celebrity influencer participated in an early trial by the company, sued 8-Bit Global after receiving a deadly nano diagnosis, which went viral, only to learn later through traditional testing that she was not accurately diagnosed. Oh. She was suing for damages and access to the raw data, which 8-Bit Global was withholding.
Yo, are you telling me that I don't own my own data? People went ballistic all over the world. Is 8-Bit holding my health hostage? Can they sell my health information to insurance companies? What?
Yeah. It reminds me of those old Gen Z stories about when people posted pictures of their lives and their kids on that old site, Facebook, and didn't get paid by the advertisers for sharing all that information?
Right? Crazy.
And still, while all these protests and court cases were going on, sales for the Nano were off the charts.
So, what has ItBit Global told us about Nano 19? More diagnostics, improved accuracy, greater tech support?
That's it? That's what all the fuss is about? Let me give you a little tip, ItBit Global. How about you figure out ways to make this tech available to all communities in my country? How about you guarantee transparency and confidentiality? How about you tweak those AI algorithms to serve real people, young people, old people, vulnerable people? ItBit? How about you make sure that you're
So that is it, my lovelies, for this edition of our Tech Talk. Don't forget to comment with the #, blink for the internal 24/7 injection of our page. Thank you, lovelies.
Great, thank you, Jeff. So what I want to ask you, and then everybody, if you have the thoughts or questions, please raise your hand by indicating, and then I will definitely make sure that you will be able to speak up. What I want to hear from you is, Jeffy, if you can go to the next slide. Yeah, great. So what do you think this likelihood that the cyberpunk Africa is going to happen? And then what are the good things about the cyberpunk Africa with all those technologies? But then also what makes you worry about this future where everybody can have maybe some technologies that will tell you how many years that you have more to live? Any thoughts or reactions to this future of the cyberpunk or something that you don't quite understand? Please raise your hand and then we'll give you the floor. No reactions? Yes. Hi, Rogers, please.
Hi, thanks so much. I think I love a bit part of it because I've seen like it's also going to support those people who are depressed in terms of anxiety and depression, and also in terms of guidance due to dietary. Basically, those are the things that I think are unique about it, and being that it's like 24 hours. But now my fear and worry is in terms of accessibility, basically for those people who are coming from the rural areas. Like over here in Kenya, in terms of technology, we are not that well in technology. And basically you find like this technology the only benefits those people who are coming from towns, and those people who like are able to access the internet and are able to at least have some information and knowledge on the technology. How about those people who are coming from the villages with no information and knowledge on technology? Thanks so much.
Great, no, thanks. And then I think that the one possibility of this future is that people can sell their health data to these companies, and then these companies can make money out of selling the data to insurance companies or drug companies or all those DNA companies, so that they can, you may not need to pay for the money for these services, but then you may not have control over your health data anymore. I would like to ask Yared to, I see that Yared's hands up. So what do you think, Yared?
Yeah, no, I thought it was really interesting. And I thought there's quite a few parallels to what's happening today in terms of how the poor can't access some of the, more advanced technologies, things like dialysis. So I thought, you know, seeing that in the future, it doesn't surprise me unless there's change that happens. And I think it reflects that we urgently need it, because as the technologies get more and more powerful, I think the inequities will become deeper and deeper.
So you think that this is very plausible future?
Well, I hope it's not the case, but unless change happens, I think this is probably the path that things will go down. But
okay,
change is
great,
possible.
thanks. Yeah, and then we can discuss more about that, like what we have to do to stop this path or accelerate the path in the better way in the next sessions. Any other thoughts from anybody? Yes, Felix.
Yeah, I think this shows us that the future for technology is what will dictate how healthcare is going to be provided in Africa. And as we are seeing with the trajectory for universal coverage discussions, the people who are the poorest are the ones who are likely to get access to advanced technology to access healthcare during that future. What we don't know is that if the poverty level in Africa will have significantly changed to enable more and more people to be able to access healthcare technologies. So I think my worry is about access by the poorest, as well as data security for the big data, because it's a big issue even at this generation. And our discussion probably is once how we would ensure that future is inclusive of young people, and it's also embedded on basic rights and freedoms for young people, as well as access to safeguarding confidential information for themselves and their loved ones.
Thanks. Yeah, I think that there will be a new way of inequity started to happening, I think, in this kind of scenario. Dr. Franklin.
Thank you. Please, can you get me?
Yeah.
All right, thank you. This is quite an interesting, venture, and I must say I'm impressed. When I think about what you have just presented and Cyberpunk Africa, the first thing that comes to my mind will be the concept of infodemics, misinformation that will be coupled with this issue of cyber, and data and stuff like that. We can see clearly now with the COVID-19 vaccine, Africa is suffering from what we call vaccine hesitancy. As a public health professional, there are many countries that their vaccine doses had to get expired because of those external factors. So with Cyberpunk Africa, and even with accessibility, as other speakers have mentioned, there's going to be the need to improve the health-seeking behaviors, information, like harmonize it in a way that people can accept. The second thing is also about religion fanaticism. In Africa, there is what we call the concept of miracle advertisement and religion and, spirituality that influences people's perception of what they take, of their health needs and things like that. So Cyberpunk Africa is going to be, a good scenario, but we'll have to be in a system where it is well communicated, people have the means to understand what it means and then accept it. Thank you.
Oh, those are so great points yes, that I cannot agree with what you said now. The infodemics is going to be really rampant, potentially in this kind of future. Any other thoughts or reactions? Maybe then I can go to the next scenarios and introduce you to muddling through. So muddling through is the next scenarios. This is where all those existing tiers of licensed professionals, like doctors and nurses and midwives, and then also a more formalized community health workers, they are the deciders or like a big influencer within the healthcare. And then there are more credentialized professionals, and then also not yet. And And then the specialty clinics and the care providers would be there. It could be more NCD work, and then the WHOs, and then also like an organization like a Global Fund and Gavi will be still very strong. And then also like a shaping that the discussions within the healthcare. And then it's going to be very similar technologies and a similar care, but then the shape may be a little bit different in the way that the distributed. And then what I'm going to show you the movie, you would hear a person, so you're going to meet the guy who's going to talk about what kind of life that they're experiencing. But what I want you to pay attention to is at the same time, there will be another new storyline happening in the same screen. So please pay attention to both what the guy is saying and then also what the screen showing at the bottom in the bottom in the screen. So let's go to the movie, Jeff. This is not the one, Jeff. Sorry about that.
Welcome back. Now, it is time for a special in-depth look at the groundbreaking passing of the Universal Health Care for All Africans Act on its 5-year anniversary. Hailed as one of the most important pieces of legislation in Africa's history, Kenyan President Kamu called this act the supreme law of the land and proclaimed that excellent health care would be promised to any African who needs it, period. The initiative to provide health care for all of Africa was not an easy road to travel, but there was enough economic incentive and inertia to move towards a resolution that was heavily debated, revised, and ultimately passed 5 years ago. Statistics have shown that in the past 5 years, vaccinations are at an all-time high in rural villages, having increased 100%. HIV-positive cases are low, and officials are looking towards an AIDS-free generation to come. Malaria is also well contained, that is, considered a negligible part of the disease profile throughout Africa. Recently, our Kenyan correspondent Robert Abib toured a clinic to Kisumu which specialized specifically in gene therapies. New state-of-the-art equipment and machines were observed in spacious halls and rooms. Specialized technicians and physicians were giving specific attention to their patients, highlighting a new wave of patient care and global health leadership. But the question remains, is excellent health care being provided to any African who needs it? We spoke to one gentleman about his experience with the healthcare system. Mr. Benjamin Kitam, an executive at a regional software company, shared his observations with us.
I was able to have access to the resources I needed. And a friend of mine made sure that I have an appointment with the top specialists in this region. And I was able to undergo the procedure that helped with my condition. I feel okay now.
Mr. Kitam went on to say that it was inspiring to feel his community taking care of each other.
I believe we should live in a country where everybody supports each other's health and well-being. And in my experience, that's what we do.
Inspiring indeed. And there you have it. A new healthy Africa providing excellent health care to any African who needs it, period.
Great, thanks. So this is the world that international organizations and government will declare universal health coverage act is achieved, and then everybody on the paper is supposed to have access. But in reality, I think that many patchy world exist, because you saw in the news, bottom line news feed, that the child mortality rate is still going up, corruption is happening, and some people are not getting access to. Yet Mr. Benjamin, who had a lot of money as an IT company leader, have the great access to the healthcare. So what do you think what would be the, what are the good things about this muddling through scenarios? And then what makes you worry about this future? How realistic this may be happening in 20 years from now? Any thoughts? Please raise your hand. Yes, Rogers.
Thanks again. Actually, based on the video that we've just watched, I have a contrary opinion, because like we work in these areas, and we are always in contact and see what is happening over there. What is being said basically when it comes to universal health coverage, it's not real. Actually, when it comes to access, because like even if I give a scenario of like Kenya, most of like even the piloting program that were done in major hospitals, and for those hospitals and the health centers within the facility, these access to these programs are still lacking. But I think in the future, I believe the issue is always lying when it comes to like the major problem is on implementation. When it comes to documentation and even sharing or information, it's always there. But now these things are not implemented to those people who need it. And I'm so worried about those people who are still like living under poverty and cannot like even access sexual reproductive health services. But to the rich, these things are accessible to them. That's why even if like someone is sharing a success story, they are sharing based on where they are and based on their social classes. But for those people, especially young people, access to these services are still limited and still challenging. And I believe when young people are included in such programs, especially during initiation and implementation, definitely it will reach young people and it will reach our community. Thanks so much.
Great. I think that the many things that we may be already seeing something like this. In reality, a lot of pilot program at the big hospitals, but then really patchy, inconsistent application of those new knowledge. So that may be the case. Dr. Franklin.
Okay, thank you. Please, can you get me?
Yeah.
All right. Modeling through and universal health coverage is quite an interesting domain. And the first thing that comes to my mind when I get this is how can we break the vicious cycle of poverty? My friend from Kenya mentioned it. Imagine in Cameroon, for example, a woman lives 500 francs per day, meaning that her job is to roast maize and sell. And if the child falls sick of malaria, the income she needs to even treat that child for malaria, it's not her capital, she does not have enough. So we need to break that vicious cycle of poverty in order to have this thing of modeling through. And another thing too that comes to my mind is the user-centered, like the patient-centered or the context-specific training of our health workforce that will be able to handle this. What I mean is we have the issue of training in Africa. There are many schools that when we apply for jobs at times and things, they will say the training is not well equipped per se. You have to get a fellowship abroad in order to come back and get experience. So how can Africa start training its own? And lastly, the Abuja Declaration. All nations are supposed to give 15% of their budget per se. We're not supposed to depend a lot on foreign aid and things like that for us to have that universal health coverage. So modeling through, we will need to have that context-specific patient-centered training, break the vicious cycle of poverty, and lastly, implement the Abuja Declaration while looking and believing on our own means of investing and universal health coverage. Thank you.
Great, thanks. I would like to ask Felix and then the next to the Akele World to speak up. Felix, yours.
Thank you. I think when I watch this modeling through, I think the question we need to be asking ourselves in Africa is whether the strategies and policies that we have developed for universal health coverage and the investment decisions are actually based on facts and data, and whether or not we are just politicizing universal health coverage dispensation without actually getting down to understand what is happening in the community. For instance, in Kenya, 1,000 patients are served by just about one doctor. And yet we are looking forward to covering every single household with a basic health benefit package that as envisioned by the national policies and strategies. But if you look at the divide that exists between the reality of the way things are and the ambition to achieve universal health coverage by 2025 to 2022, which is next year, you see the divide that the video is trying to show us. And I think it's high time that we link the investment case for universal health coverage with existing data and evidence that is factual to be able to plan realistically and also employ the proper strategies that are going to help us eventually reach the poorest person first. Thank you.
Great, thanks. I hope I'm pronouncing your name right, but then Akale World, please.
Thank you, it's right. You're pronouncing it right, it's Akale. So my comments about the second video that we saw is, I agree with most of the underlying premise in that this type of scenario would be patchy. For example, in our country, we have like this, it's been around for a while, almost a trial of social health insurance, so that primary health care is covered by the government. But it's true that it's patchy and it's not very well distributed. And it's also true that it hasn't been able to reduce disease-related outcomes significantly. And it's also true that it's plagued with corruption. So in the future, this kind of outcome perhaps would be plagued by corruption as well and wouldn't be very effective. But my point is that so assuming that the video that we saw is somehow set in the future, then we would assume that imagined scenarios are not happening only in the health sector, but as well as in every other sectors of the society, the economy, and the politics inside of Africa. So healthcare being a very lucrative economic sector in any country, I doubt that in the future, with growth of nations and with increasing economy, I believe that there will be a lot of involvement from private sectors into this health sector. And any attempt at providing this sort of universal healthcare, I doubt will be led primarily by healthcare professionals and will be more of a privatized industry as we see in some Western countries.
Great, thank you. I think that I agree with you that this importance of the private sector and then how we will be able to take advantage of the participation in the healthcare will be critically. That we need to think about that. That's really important topic too. Any other thoughts about this future of that we are going to be really struggling through and then continuation of what we have been doing, and then that seeing the future is this muddling through scenario. Okay, great. We're going to deeper into the discussions in the small group discussions about this. The next one is the final scenario, which is the Farther Together. The Farther Together scenario is basically telling us that there will be a new emergence of the leader in Africa And then also like a thinking and then realizing, especially after this pandemic, that the healthcare cannot just be within the national borders, but the more regional and then Pan-African collaboration is going to be critical. And then the health is not just about the treatment of the who has symptoms, but then also really thinking about the well-being of the people. But then in order for us to manage all those different diseases and then the forcing that the more of the collaboration, there may be some of like the command-based healthcare may be there in order to make sure that the prevention will happen. So it's not so much of the freedom there, but then much more unified, collaborated, and coordinated healthcare. That's the farther together scenarios. So we would ask Jeff to show us that, let us meet the future citizens from the farther together world.
Ocean, hi. Oh, can you see me? Hey. Oh, your hair looks so beautiful. Did your mother do that for you? Hey, I am so happy that you chose me to be a part of your school project. In fact, I'm honored. But your question is a serious one. And while I feel like the story that I have has a happy ending, the beginning is anything but happy. So, your question is, what was life like before the World Health and Wellness Accords of 2037? Well, as a child growing up in a small rural Nigerian village in the late 20th century, we did not really have much faith in the medical system. So many people were suffering from poverty and contagious diseases. The hospital was over 50 miles away and could only be accessed by traveling through poorly maintained roads. Of course, we had health workers in our communities, but they couldn't fulfill all our needs. We lost people, oh, good people, friends, family. We felt alone. We felt abandoned by our leaders and the government who are supposed to take care of us. But then things started to change, and that change began with new, fresh leadership. But some young, innovative and courageous leaders took positions of power and started to talk about cooperation, healthy lifestyle, health infrastructure with public and private options, climate change, and about investing in the health of the citizens of this world, and how all of these things could actually be good for economic prosperity. Wow. Healthy people equals healthy economy? Whoever would have guessed that? I will never forget that moment. You've seen this on your social media or hologram feeds, eh? The time where Vincent Nganga stood up during the opening session at the United Nations General Assembly in 2029 and led everyone in an impromptu 10-minute meditation. Hey, I thought the US ambassador to the UN was going to walk out of the room. That singular moment, my dear, signaled a change throughout the world, a change that indicated that effective global leadership starts with the health of its citizens. And that moment seemed to signal an end to the old guard and a beginning of something new. I wouldn't know what to call it. Maybe global compassion and empathy, partnerships and collaborations that benefited the common people and not just the powerful and privileged. Over the next few years, we started to see more infrastructure related to the wellness of the people. Roads, parks, increased education related to healthy lifestyle, even more resources dedicated to family planning, and more healthcare professionals that could handle the needs of the people. It just felt like the people running the world and our country really understood us and the problems we face every day. It felt like an unprecedented time where healthcare infrastructure was jointly funded by the public and private sectors. Everyone was invested in the prosperity of our nation and its people. And we were no longer the world of the 2020 COVID-19 pandemic, where nations scrambled in isolation to control the spread of the virus. Now, protocols of preparedness and response have been generated in collaboration with the global community and shared widely. Of course, there will always be some nations that resist input and collaboration from the outside. I suppose it's natural to want to protect your own. But by opening your arms and reaching out to others, we have learned that we can more effectively protect our own. It's important that you understand that the world I grew up in was not a healthy place. It was not a place I would ever want you to grow up in. And I am so glad that you don't have to.
Thanks, Jeff. So this is the different world from the previous two scenarios. And what do you think? Is there something you want to see? What would make you worry in this kind of super collaborative world? And then what do you think this would be great for the future? Any reactions? I would love to hear from other people too, like who have not had opportunity to talk about, but also that I would definitely welcome. Yes, Dr. Franklin.
Okay, thank you. Sorry if I'm speaking a lot.
No, absolutely great.
All right, thank you. I just want to rewind my experience with the United Nations Office for the Coordination of Humanitarian Affairs. I was responding to the COVID-19 pandemic in Cameroon. And what I realized is that there was massive influx of humanitarian support. Such that many organizations were pumping support, and there was a need for that coordination, like to streamline, to say that who is dealing with this aspect and the other. So I think that in the future, with this kind of collaboration and everything, there will be need for more stronger coordinated way of differentiating who is supporting and who is doing what and where, and equally when. There's also the concept of competitive intervening. Organizations who want to compete, to say that I did more, I did better than this. But we all know with the philosophy of Socrates, they say when you share, when you strategically partner with another, we gain more stronger outcomes. So I think that is just my own, that with the massive influx of all of this support and everything, there needs to be a coordinated way of saying that who will be doing what and when, and also to make sure that we are not duplicating efforts. Thank you.
Thanks. I think that you're raising a really interesting and an important point, because all the organizations and then also the country government and then others wants to say that this is what we did, and then this is my contributions, or this is our contributions, and then, but then in this world of the father together, we really need to see that that kind of we own the progress, or we own the achievement mentality is going to be challenging. And then I wonder how we're going to be able to change the mindset. I would like to ask Rosas.
Thanks again. Actually, what I love most is on issue to do with the partnership.
basically partnership has really helped because there are people who lack skills. But when it comes to partnership, people have been able to learn from each other, and there's a lot of improved transparency and accountability, which was not there before. Because if you are doing it on your own, there's no one who is maybe checking on you. But in terms of partnership and having policy agreement, definitely I've seen a bit improvement in terms of transparency and accountability. Like even currently, when we are looking at COVID-19 vaccination and the kind of vaccines that are given. As a country and as a personnel, you have to be accountable for the vaccine that have been given. And these vaccines, in Kenya, are given through partners. So that one is really helpful. And another thing that I will really talk about and emphasize on is about leadership and having good leaders in place. Because we've seen most of our countries which have corrupt leaders, even corrupt providers, definitely. When it comes to access and even improvement, there are still challenges. Because if you are having a wrong leader, even with issues to do with the resources, they will not be able to even have a structural places for good healthcare. So the best thing that is happening currently, young people are coming up, and we are trying to have good leaders in place. This will really help and be a great way to improve healthcare.
Thank you. And then I think that you really raised the important point here in terms of a partnership also have to come from the accountability. It's not like you will just say I will do it or my organization will do it, but then if we want to work together, then we will be held accountable, and that's really a challenging, sometimes challenging things to do. And thank you for that contribution. Felix, and then going to Mariama, sorry.
Sure, thank you. I think when you look at COVID-19, we have seen a very unequal space for COVID-19 vaccinations in Africa versus the developed world. We have seen vaccination nationalism, where the first world comes first, and then Africa gets donations for vaccines, leading to suboptimal coverage. For instance, Kenya, I think, has vaccinated less than 1% of the population. Comparing that to US and other developed countries, it's extremely unequal. I envision a future based on this video that Africa, as a developing continent, will have opportunity to actually reduce the inequalities, especially in accessing life-saving vaccines, and also being able to monitor and respond to pandemics and epidemics in time. And I hope that future also will not leave the poorest intra-country behind. Thank you.
Thank you. I would like to ask Mariana, what do you think?
Yeah, thank you. Hi, everyone. I think this scenario was the one that really, spoke to me very, very deeply, because I'm seeing so much good things in that, so many good things in that, because I've seen, first of all, this, intergenerational discussion between this woman and her granddaughter, maybe. And he was, giving her information about what was the past. And I think we've seen that good leadership is important. And, this dialogue between generations is important, so that young people that will be, the next leaders can learn from the past lessons and can make change. And when it comes to health and wellness, we have a really long path to go in Africa. And I've heard of climate change, need of health infrastructures. And I think these are points that have been taken in account, and that is really brilliant. But what I'm worried about this scenario is it's good to have all these changes, and it's good to see that we are moving forward and everyone has access to health services. But it will also need a permanent review, permanent work, because the world will still change. We've seen the COVID-19 pandemic. No one was thinking about that. And this has shown us that we really need to permanently have in mind that things can change, and even the use of technology can be challenged by, natural incidents, climate change, and even biomedical services that do not follow. So we need to really think about how we will handle that, how we will handle cybercriminality, for example, also how we will handle the kids using this technology to access health services, how we will preserve this, all of that. So I see that it is brilliant to have technology, and it is brilliant to see all this universal health coverage, but I'm really worried of how we will maintain that in the few decades. So we still need to be thinking of permanently working on that.
Yes, I appreciate that. It's really a great future, but then also like a lot of the efforts that they have to going into it, and then thinking about the changes that may bring us. Any other thoughts? I would love to hear from others' reactions. Okay, if not, I would like to launch a poll. So what I want to hear from you, or this is a simple poll. So we presented these 3 scenarios, Cyberpunk Africa, Mothering Through, and then Future Together. What is the future that you want to see? And then what kind of 20 years from now, you would be a major player within this world? And then what kind of future that you want to be living in? Please pick one from the Cyberpunk, Mothering Through, or Further Together. Did everybody vote? Jeff, do we get to see the results? Okay, there are some people who have selected the Cyberpunk, maybe thought like this may be the reality, or like want to live, and then the quiet majority went for the Further Together. I think that there are a lot of positive in the Further Together there, and then it's kind of natural, and then also important to recognize those partnerships, and then also ensuring that the health is also considered from the well-being perspective and working together. I think that what we want to do today is we're going to show you a short video. This is where we are going to see the artist painting some of the themes that are coming up from these discussions. And then we're going to go into the micro labs, which we're going to break up into the groups, and then we'll have a deeper discussion for those each scenarios. So you will be automatically assigned to one of the scenarios. And then we want to hear each group to examine what are the major concerns in these scenarios, how realistic that would be. How do we make sure that the people, especially poor and vulnerable people, receive needed healthcare in each of those scenarios? And then whose responsibility is it to ensure that the vulnerable people are going to be accessing? Is that by the government, or is that by the private sector, or is that the people themselves? Or international community, and then whose responsibility is that? And then also what is the role of the government, civil societies, that the young leader in working in this kind of environment, make it better, or make the change the bad change from happening, and then how you're going to contribute to that. So those are the key discussion points for each groups. I would like to hand over to Jeff to show the short clips here about the art by the Gegetto.
Cyberpunk Africa for
Great. So now we're going into those breakout sessions. You will be automatically assigned. Please make sure that you will identify somebody going to report back to the entire group for the 3 minutes of your conversation. Summary of the conversation in 3 minutes. And we are going to go into discussions for 10 minutes.
Hi, Lydia. Hi, Lydia.
Hi, how are you?
Fine, thank you. How are you?
Good, thanks.
Is this our group?
I have no idea. I'm just joining back in and there's just 2 participants.
Yeah, I kind of got lost. No, my connection was not very good. I don't know what you're supposed to do. Hello.
Hi, everybody. I don't know, I felt like it was a little bit too short for us. And then
We're still in the middle of our discussion.
I know you were in the but maybe if we can have the report back from each groups. I think that, may I ask the Cyberpunk group, that anybody that if we can report back, that what was your discussions like, and then what did you discuss?
Hi, so I'm Makalo from the Cyberpunk group. So the discussion was a bit short for us at the time, but so in the time we had, we tried to discuss about the possible fears that we'd have with the Cyberpunk kind of Africa for the future, Cyberpunk type of healthcare in Africa for the future. And one of the main concerns we raised was, of course, the security threat that it poses and the potential for security breaches and for patients to lose sensitive data about their health. Another issue that we raised was considered individual patients, could this cyberpunk type of technology could potentially lead to overdiagnosis, overtreatment of patients, and maybe eventually create a new type of health issues that we don't know yet as a result of that technology. Another thing that we discussed was we tried to recognize that the technology in itself is not entirely bad, and there might be a way for it to be integrated into a more inclusive and patient-centered or more like a further together type of health model where the technology can be put to good use while under strict supervision. Thank you.
Thank you. We will make sure that the next breakout sessions will have plenty of enough time for us to continue discussions and then also have the more conclusions. So I'm sorry about that time allocations. I would like to ask Madeline through Teams, and then because I forgot to assign people, so maybe is that okay, Roger? You can represent us our discussions. Thanks.
Thanks. I can, though we didn't have much to discuss because of time. But basically, when we are talking about modeling and we were trying to link it with universal health coverage, we saw that we were giving some stories based on the experience that we've had. Actually, the experience from Kenya is the major focus when it comes to universal health coverage is about maternal health. And there's no other conditions are not included when it comes to universal health coverage, like cancer and HIV treatment, which I feel like are so burdened and need to be included in universal health coverage, not only in terms of access, but also allowing the cancer patients to maybe go through care and treatment. And we were looking at it's not rolled in every facility. So if it's being modeled, it should be enrolled in every facility, be it in rural or in even urban centers. But we were checking why is universal health coverage focusing more on maternal health? One, we were looking at in terms of cost effectiveness. Is it cost effective? And in terms of they cannot include every condition. So for the purposes of resources available and cost effectiveness, that's why in Kenya, they are focusing more on maternal health and childbearing. And also we are looking at in terms of those who are important. Basically, we know children still have a long way to go. They are the future generation, and now their health is much more important, and looking for the health of the elderly. But we are not disputing the elderly are not important, but health of children is much more important compared to the long way that they still need to go. And just one thing that maybe I would love to add is when we are trying to model this in terms of coverage, we should try to incorporate and work with basically youth-led organizations, work with organizations that are focusing more on health and on issues to do with the resources. Because this thing will not come to pass when resources are not there. So when we are working together, we'll be working together in terms of resource mobilization and also in terms of implementation. Thanks so much.
Thank you. I think that that's a really great segue for the next discussions after we hear a little bit more from the other group, for the next discussions around the resource mobilization. I just wanted to say one thing in reaction to it. In 2040, I will be mid-70s, and then I hope that you will not forget the old people, because I will be old people in 20 years. I don't want to be left alone. Anyway, thanks. I would like to ask the group from if the discussions happen from the Father Together group.
I too forgot to ask somebody to write notes and speak up. So as to not put anybody on the spot, I'll do it this time, and next time we'll pass the baton. You know, we too were, you know, short on time. So we talked about needing to work from the bottom to the top approach rather than the top to the bottom approach. And recognizing that, you know, if we're going to move further together, we need to look at indigenous cultures. We need to look at holistic and traditional options and opportunities. And one of the concerns that we had was there was this beautiful conversation between this grandmother and this granddaughter, but how is it that we got there? And how does that happen? We have to invest in education. We need to use technology, but we also need to make sure that those in rural areas have education and access. And how does all that happen? So our concerns are not the end result, but how do we even get to the end result?
Great, thanks. I think that how we're going to get to the end results, and then what's the process that we're going to take, and then how we're going to contribute to those processes, really a critical part of the discussions I think that we have to have. And then also that as Rosa has talked about, like what is the resource need that we have to address. So with that said, what I want to do today, what I want to do next is that after this hearing about the pros and cons, and then also with some discussions, I just want to run the poll again, and then what is the future you want now, to see that if any kind of opinion has changed, and then also that we will run the quick video, and then we'll go into the polls, please. We can't. There's no sound. Sorry about that.
Cyberpunk Africa for the win.
Vote for me.
Vote for me. Vote for us.
Muddling through, show some love and vote for me.
You are all intelligent future leaders, but respect your elders and let us go further together. Vote for me.
Great. So let's launch the poll, and then who are you going to vote for? Okay, once the poll is done, let's see how it happened. Okay, we still have the Father Together for 86%. It was 88% before, so there was a slight dip. Now we have the modeling through and in Cyberpunk there. That's a little bit interesting. So I want to going into the next slide, next segment of this workshop. I would like to hand this to the more different discussions, and then I think Yared, I think you're going to take to it. Thank you, everybody.
Thank you, Dai. So Jeff, we're going to show an update from Jigeto's live painting session of this discussion, and then we're going to go to Shushu from the Global Fund. Okay, Shushu, you are on when you're ready.
Great, thank you so much. So now you have seen a lot of the fun part of the work. Now we're going to go more into the serious part, which is financing. Who pays for all of this? And as you know, this creates tension everywhere, not just in health sector, but it's in everything. I'm sure you understand. So health systems financing is really closely linked to the ability to access healthcare. And what we know from current data is that to increase access to basic health services in Africa, we have to have a big shift in increasing substantial resources. And in order to do that, the big question where people are asking is, where will this money come from? So in the Africa region, there are three ways where this resources can come from. One is government-owned budget. Two is external financing from development assistance. And three, which is probably one of the biggest components for many African countries, is out-of-pocket spending. And of course, there are others, voluntary prepaid healthcare, insurance, and other private sector. But really, these are the top three. So let me start off talking about out-of-pocket spending. And already some of the many speakers this morning have alluded to that. The WHO estimates about 100 million people globally fall into poverty annually because of out-of-pocket spending. Often those most in need are those who can't afford to pay out of pocket. Then there are those who can't afford at all to even seek care. And this, of course, many of you already know, exacerbates, inequality, equity in accessing to health care. So in Africa, the out-of-pocket expenditure varies, hugely from 3% to 77% of health spending, current health spending. But we shouldn't look at that in isolation. And that's because, sometimes low out-of-pocket spending doesn't necessarily tell you the whole truth about access to care. And so when we're looking at, out-of-pocket expenditure, it's really important to look at it alongside service coverage and financial protections. And that is what they're doing currently as part of the Sustainable Development Goals 3.81 and 3.82. So secondly, the development assistance accounts for about 0 to 68% of health spending in the Africa region. It varies widely, but it is targeting mostly, low-income countries. And for countries in that range, it is vital and important to access healthcare services, especially to critical primary healthcare, immunization, infectious diseases such as those we have talked about, HIV, TB, and malaria. However, as we all know, development assistance is quite unpredictable, not difficult to predict in the long term. Secondly, politics change. Thirdly, there is, it's linked to the broader global economic environment, and you can see that under COVID, even developing countries for providing these assistance, there's a lot of pressure on their economy. So you don't know when and how much of those resources. And then priorities tend to shift. And we've seen that now, even in the Global Fund, where we see that the huge priority shifting towards COVID-19, and before that, Ebola. So there is a real threat in terms of, the uncertainty that countries face with they are going to get resources or not externally. And this risk is, about tackling sustaining the gains. We've already sustained the gains, so it can impact a lot of the gains we've already had in health outcomes. So that as countries also have to double now in new challenges that are coming. And thirdly, but I think it is the most important of all the components, is the domestic. Future of sustainable financing for the health sector is really domestic. It is at the national level. I am sure you will all know that in 2001, African leaders got together, recognized the need to invest more in health, and signed the Abuja Declaration, which says at least 15% of government total budget should be invested into health. And that is 15% of all money the government raises annually. Whilst the figures, change from year to year, and some countries make it from year to year. However, in this current year, in 2021, according to the latest WHO figures, 0 country meets that target. And of course, COVID has played a huge impact on that. So what is it that countries, can do, or what we can do? I think what we could do is advocate. I think that's because health financing or allocation into resources and utilization of resources and efficiently is really primarily a policy issue, a political issue. And so advocate with all the stakeholders, influence your governments, those decision makers, at country level, partner with parliamentarians who have the oversight role, civil society, citizens at large who influence the way politicians vote and care about. So, and also really insist on having national dialogues at country level, because it's really at that level that we're able to encourage and influence that countries take health sector investment seriously and think of it as an economic benefit rather than an expenditure. So the second piece to that is helping countries to do the health financing reforms that can support driving better results, reforms that can actually bring more money into the health sector or more health for the money, and looking at equity, improved financial protection, while I think at the same time trying to build leadership and ownership of the health financing agenda, as governments have an obligation to provide healthcare to their citizens. So I think those are some of the things, and I and all of us here today, we are looking to you, young people, to really take this forward and advocate with your respective countries, with your respective governments, respective parliamentarians, join forces with other stakeholders at country level, at global level, to ensure and to hold and to account the governments, and to make sure that they invest in young people, in you guys, as you are the future generations to take this up and in the future. I thank you.
I hope everyone's had a chance to vote. Yeah, okay, so here we have the screens up. So I think the results are a bit different, kind of similar to our priorities on a global level. So we have education and health tied for first, which is no surprise. Roads, clean water, and infrastructure is fourth behind agriculture. So yeah, I think this is interesting, especially that education and health receive the highest prioritization. And I think it does make sense in the African context. But yeah, like Dai is saying, no manufacturing, that is the big omission. But yeah. So now I think I'd like to open this up to a group discussion. So I'd like to get to know what each of you think personally, and feel free to raise your hand or just type in the chat so we can get an idea of what your thoughts are. Okay, so we have a thought from Marira, Felix.
Yeah. So basically, I think in Africa, in Kenya, basically in Sub-Saharan Africa, the health coverage is poor. For instance, Kenya has 83% of the population that are in the informal sector, but only just about 15% are covered through the National Social Insurance Fund. And the people that are most likely to suffer the worst health outcomes are the poorest people in the society. So we are a very unequal society in terms of health access, and I think for me it becomes fundamental to invest in the future in terms of healthcare. Also, we have food security, which is quite unstable, and if someone is suffering from hunger, they will not have good health outcomes, they cannot attend school. In many cases, studies show that in Kenya, children miss school half of the time because of lack of food in most of the subnational units, and that means that it's a critical factor to consider. And that's why I was surprised that I didn't see climate action being mentioned, because a lot of food insecurity is occasioned by the climate change in Africa and in Kenya, because people rely on natural weather rainfall to actually do farming. And thirdly, education. The transition from primary to secondary education is pretty poor as we speak. And if you do not have an educated population in future, you're unable to do something about the population, or even have a strong technological driven population, or even education, or even improving food production without a good education. So I thought those three for me are critical for us to be able to have a better future for this country.
Yeah, for sure. I think climate change also relates to changes in disease profiles in Africa, which we'll see, and as well as health. So climate change is definitely one I hadn't considered as much as I should have. So next we have Rogers.
Thanks so much. For me, like we always say, a healthy community or a healthy community is a wealthy community. For you to like be wealthy in terms of knowledge and in terms of investment, definitely health comes first. And if you're having healthy people, healthy young people, we'll definitely have a wealthy community. So the first focus on is investing more in health, be it non-communicable and communicable diseases. And basically, when we are trying to talk of young people, we'll go into sexual reproductive health as well. And then another thing is education. When we are talking about education, we are talking about, we are trying to come up with courses that are relevant. Because like we've seen, like in Kenya, so many people are having done courses which are not helping them, even in terms of like, now they have knowledge, they have skills, but now where do they use the knowledge and the skills? So we are trying to like, I would wish to advocate for technical courses in terms of education, whereby you can even be your own employer and create self-employment and create employment for the general community. And also I'll go into issues to do with agriculture. Basically, agriculture is the backbone of most community in Kenya. And if we are investing in agriculture in terms of technology, definitely will reduce poverty and hunger, which is striking basically the northern part of Kenya every year. So investing in agriculture and trying to like bring partnership in terms of knowledge and skills development, which will definitely help and ensure that the community that we are serving are healthy, they are informed, and they are able to like develop.
Yeah, that's great to hear. Now we'd love to hear from Mariama.
Yeah, thank you. I just wanted to say that looking through the answers of the survey, I got one thought, and this is something I've always said, that Africa is a powerful continent, and we have a large population, but we are also a very diverse continent. So we have different priorities and issues. So I think this is why our answers were a little bit, two things we were sure and agree with were education and health. And when we come to education, I think education is completely linked to health. When it comes to training health workers, when it comes to having an educated community that can access, technological health services. So I think these are interconnected, and this is why we need to really focus on them, and also thinking of Africa as a diverse continent and looking through the similarities. For example, I mentioned defense. You see, defense isn't something that is a priority in another context, but in my context, it is a priority. So we need to really look at the regions that have the same issues. I think this is a reflection, and really gather their power and make sure that we impact on health through others sectors.
Yeah, that's great. I think especially within education, I'm seeing in the chat now, is education definitely forms health-seeking behaviors, and an educated population will hopefully have more desirable health-seeking behaviors. Things like getting children immunized. Although that isn't always the main barrier, it definitely is a significant one in many places. And now we have Dr. Franklin.
Thank you. I think my colleagues, my friends, have said all. But just to highlight the key point, health is wealth. Health is wealth. There's nothing you can do if you are not really healthy. And I think the second is education, because education gives us the knowledge, and knowledge is power. So with that knowledge, we can be able to comprehend and apprehend all the other sectors that we're talking about. I raise my case.
Yeah, that's a great summation. Any other points? Anyone else have any thoughts? Okay, so I think now we're going to go into our second microlab, if that's all right. And we're going to be talking about who pays the bill.
of what every country does and best lessons and, in the implementation. And what I would like to finish with, I'm very appreciative for this meeting. I think I've learned a lot to see young people, aiming at changing the systems and how they are passionate about it and spread the words. And I think where there is a will, there is a way. Thank you so much for making me part of this conversation.
Thanks. And all back to you. Thank you, Charles. I really appreciate that.
Okay, so I think now we'd like some representatives from each of the breakout rooms to just briefly summarize what you were talking about and who's going to pay for this. So I'm not sure what the exact groups are. So if representatives could just raise their hand, and we could just do it that way. Okay. So Dai.
Yeah, I will represent the Modeling Through group because Roger has already talked about it. So our group was from the Modeling Through, but then we discussed that a few key important issues. One is that the importance of talking to not just the Ministry of Health, but then involving the Ministry of Finance, and then their collaborations and partnership are going to be really critical. And then also, especially for the Ministry of Finance to understand that this is a great investment. And then in order to talk to them, it's very important to think about this is not just the one person or one group of people to advocate, but the multifaceted, multi-pronged approach is going to be important. For the different group of people to participate in this discussion, there may be platforms, I think that Roger's talked about, but then at the same time, that the who get invited to those kind of discussions, often the time get repeated from the very specific groups, and then often the time other people that the who may benefit from this kind of discussions or advocacy discussions can be overlooked, and then they do not necessarily get invited. And then also that the informations and the tools are not well shared ahead of those kind of interactions, so that it's not, there may be a platform or opportunity for the discussion with the decision makers, but then not necessarily always as effective as it could be, I think. And then so how we're going to prepare for those advocacy events and then the support for those participants, and then also like expanding that the participants are going to be very important for the future. So that was a discussion. Thanks.
Sounds very interesting. So could we have a representative from actually Ake, seeing as you were in our group, maybe you could present now.
Okay, hi. So the general consensus in our group was that spending should primarily come from domestic spending, and governments should be the major part. Should play the major role in healthcare finance spending. So we also discussed on how we should find alternative sources to increase the government's finance and to transfer the health finance system. So there's more funds and more resources available for healthcare system spending. Another point we discussed was on the point of brain drain and how we can better remunerate the healthcare workers so that we can reduce brain drain and have a stronger health workforce. And also on as one of the things that we could do to increase this government spending, we discussed on how advocacy is important at different levels, and especially on how advocacy is important at the national health advocacy by people living within those countries and the youth within those countries, and advocacy by civil society organizations and professional organizations as well. So the last thing we discussed was related to digital health and how data and digital health is at risk for breaches, but at the same time, this data can be used to great effect to create a better healthcare environment. partnership with a data organization that's applies technologies and how they would have access to data, but on the other income for getting the data.
Sorry, I'm not sure if that's my internet breaking up or yours, but I missed that last bit. If you
Jared, could you maybe go over for a second? And Aki, I'm so sorry about where it's going in and out.
Yeah.
But maybe Jared, you could close to give a little bit of the last bit of the idea. And I'm sorry, Aki, we couldn't hear everything that you were saying because it was great. And I took like 10 pages of notes.
So some of the final points we made were just on data protection. Oh, sorry. Okay, you want to speak? Oh, sorry. No worries. So we're on data protection and privacy, and how, while we want to ensure that this data is private and that people are in control of this data, that we also use this data because it has some revealing facts that humans can't readily access or interpret. Now we have Dr. Franklin for the final group.
Okay, thank you. Please, can you get me?
Yeah, we can hear you.
All right, we had many diverse views in our group, interesting, but just to summarize, who pays? The government should be the main person, the main body. We are the government as a people. So they have to be a kind of good public finance management system in such a way that there is evidence-based budgeting and planning for the expenditure. And that can be done through digitalization. That's to digitalize the tax system. There's a huge gap between the poor and the rich. And how can we know whether who earns more or less is by doing that. And by so doing, there can be some sort of advocacy still by the government supporting this, that there should be obligatory contribution in terms of spending, in terms of paying for healthcare and things like that. So, and also the other thing too is there needs to be a kind of monitoring and evaluation that is done for finance. Because when they spend this, when they give out this money for some kind of projects or for some interventions, they don't get to the real person. How can we track this to better it for corrective actions and all the like? So in essence, that was just our kind of consensus. And we're equally talking about the private insurance scheme. The place of the private insurance scheme is welcome. There's equally external aid and that of the population, the goodwill of the population. Thank you.
Great, that's great to hear from you. So I think the consensus is that domestic financing through governments is going to play a huge part of this, and advocacy as well. And that's good to hear some of the differing opinions about how we're going to pay for this. I think next we have another artist performance.
What kind of ancestor do you want to be? What will you leave, and what will you give to the future generations? Sharing knowledge from the past for a brighter future. can you learn from the past? What can you bring to the future you hope? If we bring all of the imagination of the past and the future together, can we build a world that works better for everyone?
So it's been amazing to hear your thoughts. We want to really thank everybody who's been on this all these hours. A huge thanks to Dai at ThinkWell Global. Huge thanks to the Global Fund for making this possible, and for Gavi for making this possible, and IntraHealth as well. And especially to each of you for being part of this. We want to issue a send-off challenge to each of you. We won't leave you after this. We really want to keep your ideas and keep you connected and stay connected to you ourselves. So here's our send-off challenge. In the next week or two, please consider recording a 1-minute video message to the world, or to your finance minister, or to your health minister, or to your friends or your favorite newscaster. Make a 1-minute video explaining why you think financing for global health would help your country thrive. Tell us about the future you want and send it to us. You can post it, you can tag it as SwitchPoint Challenge hashtag if you want. We'll put that in the link here. Or you can contact Sarah, who's been in touch with all of you about getting signed up for this. We would like to get these from you by September 17th at the latest. And if you get them to us, we're going to make a collage of these for the next public SwitchPoint. So this has just been a very fantastic small workshop with selected folks. But the public SwitchPoints are open and they're free to everyone, and they're quite huge. And we have hundreds of people from around the world joining those. So we'd like them to hear your voices. We're going to be reaching out to some of you to get probably a better recording of some of the things that you've said today so that we can include those. And we'll be in touch in the next few weeks about that. But we really hope that you will send us these 1-minute videos or post and tag them and let us know you've done it so that we can get these edited in together. And we want to thank you for your ideas and your energy. We also want to send you to something called SwitchPoint Participate. Sarah will have you all signed up for that. That's a place where you can all reach each other, be in touch with each other, connect, share your contact information if you'd like. We really want to grow the SwitchPoint network and community. That's the intention with this, that we can do what we've all been talking about rather than just talk about it. So send us your feedback, send us your ideas. We want to stay connected, and we'll be following up with an email and notes on this very shortly. We want to thank the Global Fund again, and Gavi, and Dai, and ThinkWell, and IntraHealth, and each of you for being part of this. Okay, I'm getting a question about the 1-minute video. We want it to be 1 minute on why you think financing for global health is important, specifically domestic financing for global health. Why are you, after all of this, why would you tell your health minister, your finance minister, or your friend that yes, indeed, this is a really critical part of getting the future you want as a young person, as a young leader? How does that connect to your work, and why do we need it to be done? We want your voices to be out there. As we've heard in all of these microlabs, advocacy for this is going to be really key. Your voices are the most important. You're the young people. It's your future. Yes, us oldies are depending on you and hoping that you will do well, and we're here to support you. But we really want to hear your ideas, your thoughts, and put you in contact with leaders who can take your messages further, and then we can be your support team wherever we can. So please send us those. Feel free to send us any questions. I really would love it if you guys can do this. We would include these. We will send these out. We will make sure they get seen by people that need to see them. Your ideas need to be heard, and we so appreciate that you've been part of this. So
and TikTok is
yes,
welcome
TikTok,
too.
Instagram, Facebook. We do have something we're going to be launching that we'll be announcing soon called the Future League, which is going to be featuring young people, and we'll keep you posted on that as well. There's so many exciting things and partnerships going on with the people that are part of this discussion today. So
yeah, and share with others. If there are other people who want to do the video 1 minute, please feel free to share with others. And thank you so much. And you guys are the future.
Thank you.
Equally, just saying thank you as well. It's been a pleasure listening, and I'm encouraged about the future as well, listening to what I've heard today.
Thank you, everyone.
Thank you all. Good seeing you all. Thank you. Thank you. Thank you so much.
Bye.
And Jeff, if you have a chance to run the message from the actors, they all had a little goodbye for you as well.
Well, that was amazing.
Thank you so much. Goodbye.
And good luck, future leaders of Africa.
Thank you for joining us. And until next time, goodbye.
You are the future. We have great expectations for you. I can't wait till you catch up with me.
Listen to Grandma.
And thank you, Jeff, for making sure we were all connected. Yared, thank you so much. And of course, Heather and Sarah and everybody and Dai, thank you for making this happen for us. We really appreciate it, and we look forward to the October event. And I think we should run this program again in person. I think it'll be fantastic.
Yeah.
If possible in person, if not, get a bigger youth group.
Please. Come over here.
Toma, are
Come
you
over
in?
here and do this. Let's do it.
I like it. Let's get rid of COVID so we can get back to face-to-face meetings.
Yeah.
Yeah, please.
Alex?
We're here.
What do you think?
Excellent. No. I really enjoyed the discussion. Great contribution.
I really, and I had fun.
It was super.
Thank you all so much. The future looks bright with all of you.
Yeah, Dai, thank you for thinking of very interesting things to make the discussion less boring. As you know, financing is so dry. But Dai, I really like this, using this opportunity to make it really interesting. So appreciate it.
Thank you.
Thank you. And Jeff, if you, everyone, oh, sorry, go ahead, Dai.
No, go ahead.
I was just going to say before, and people, we understand we're going a little over time, so we understand if people need to pull off. But Jeff, if you don't mind to run the Global Voices, the Youth Voices with the Global Fund trailer one more time, because so many people who are in it are on this call, and I don't know if everyone got to see it at the beginning. So no worries if you have to pull off. But here's something that's just another tribute to the Youth Voices and how important it is to share the messages from you. Thank you so much.
Thank you.
Oops, sorry.
The future I want is a future that meaningfully engages young people of all diversities.
I look forward to a future free from discrimination and marginalization.
The future I want is a future where there is freedom for everyone, rights for everyone, and where young people can fully achieve their potential.
We have to do everything we can to remove those barriers and to physically put in those structures that will allow everyone to be able to access the opportunities with which we can solve today's problems in readiness for tomorrow. And we can't do that if we don't collaborate.
We and the broader Global Fund community are acting with urgency to help countries respond to COVID-19, but also to take action to mitigate the knock-on impact on other diseases such as HIV, TB, and malaria. We need to see the same kind of mobilization, the same changing of the rules around the way science interacts with politics, interacts with communities, the way people across the globe coordinate and work together if we are going to get an effective response to this crisis. And that needs people like you.
The future is also young, in fact, very young. I want a future that embraces and acknowledges young people.
The future we want at InterHealth is one where young people see themselves as leaders in the fight for global health.
So it's up to us as humans to come together, to join our hands, your small and my small coming together and creating this big thing that will eventually shift the way the world is known to be.
Heather, can you send me that trailer?
Yes, I can.
Yeah, please, because I need to send it to show at least what we did this morning. We can say we opened it up with this. I don't know if we have a small video of this yet, but I don't think so.
No, it'll take us a little while to edit that together, but we will.
Yeah.
And so again, so thanks to everybody who's on the
great.
call.
Thanks a lot. Bye.
So appreciate it, everyone. Okay.
Bye, everyone. Thank you.
Thank you.
Bye, everyone. Bye.
Everyone, thanks.
Bye.